Hi everyone, my name is Kate Hendricks and I am the Utilization and Treatment Specialist for Substance Use Disorders for CMH-PSM, which is the PIHP for the region of Washtenaw, Monroe, Lenawee, and Livingston counties. Today I'm going to do a brief training on our concurrent review process. This could be a good refresher for providers who have been doing this for a long time or for new staff. So I hope you find this helpful. Okay, so first thing is when to complete a concurrent review. These are due prior to the end of an authorization period or prior to exhausting units within that authorization period, or to request that the client continue at the current level of care. Concurrent reviews are due at least every 90 days, and they are accepted and considered on time when they are submitted 5 days before or 5 days after the expiration of the previous authorization period. If for some reason it's going to be late, which means past the 5 days, please provide justification for the reason it is late within the review. Concurrent reviews are also used to request that the client step up or step down within the continuum of care. So for instance, if they're in an outpatient program and they relapse and need to go to a higher level of care, you would use a concurrent review to request residential treatment or withdrawal management or whatever the client is needing at that time. So the first method to submit a review is to submit it from the SUD main menu of Cricut. So first you would click on the SUD in the main menu, click SUD Concurrent Reviews for a consumer in the submenu. The consumer search screen will be displayed. The most basic search uses the consumer's last name and at least the first 2 letters of his or her first name. Once you have entered the information, click the search button and select SUD Concurrent Review, which is shown on this blue arrow right here. The second method to submit a review is from the authorizations page in Cricut. So you click Authorizations in the main menu, click View My Locations Authorizations in the submenu, and click the SUD Concurrent Reviews link to the right of the consumer's authorization, again shown with that blue arrow. After navigating to the list screen, whichever method you choose, either 1 or 2, you can add a concurrent review by clicking Add SUD Concurrent Review, shown right here in this link. So the first thing you're going to see is the Basic Info tab. In this section, you will complete the date of the review, the place of contact, etc. Place of contact is where you are meeting with the client. So this could be in the office setting, telehealth, sometimes I see jail, so wherever the review is taking place with the client. Some fields will pre-populate or update as needed. For the provider section, when you look it up, make sure that it's the correct location. Some providers have multiple sites, and each authorization is connected to one of those sites. So it's important when you do the provider section to have the correct site that the client is attending. You can then click Save and Continue to Clinical Summary, which is this button right here. Or the Clinical Summary Index link to get to the next tab. So right here, Clinical Summary right here, or Save and Continue to Clinical Summary. So within the Clinical Summary tab, you would need to complete all applicable fields. So for level of care, that is a drop-down menu. So you can select the level of care that you are requesting. This does not have to be the level of care that you are a provider of. This is where the client falls within the ASAM as needing. So even if they're not going to go to residential, but they meet that level of care, you would still put whichever short-term or long-term residential with the level that relates to that level of care. And if for some reason they're not going to be attending, you would say within the review in another section that they really do meet the level of care for something, but they're not able to go, and you can say why. But if they're going to be remaining and you're just requesting continued units for your facility, you would put whatever that is, whether it be outpatient, MAT, residential, etc. So for ASAM results, as I said, so you would click on the ASAM worksheet button right here and complete the ASAM by choosing the appropriate radio buttons that for each level and adding evidence in the text field provided. This will be shown more on the next page. So ASAM placement dimensions. This is very important. This is a lot of how we base whether or not we can approve authorizations or not, based on what you put in this section. So you complete the ASAM worksheet by clicking the appropriate radio buttons, as we said, for each level, and then you add the evidence to support this level in this text field right here, so as evidenced by. You can either go through each dimension one by one or just make a quick paragraph, as long as you fill in all the pertinent information for each dimension. So make sure the level and evidence for each dimension is consistent with the information provided in other sections of the concurrent review, including the level of care you are recommending. So for example, if the progress towards goal section says a client is doing perfectly and they're doing great in outpatient, but the ASAM shows all that they're needing level 4 for some reason, that's not consistent, so something's not right there and needs to be updated. So another example, if the client is currently an IOP or outpatient, but you are recommending a step up to residential, the information in this section will support why residential is appropriate. So if they're meeting this level 3.5, in this box is where you would say why. Next is the substance use chart. So you will need to update the substance use chart from the last report period. So from the end of the last authorization, anything that they're struggling with substance-wise, you need to put in this section that's current. So for each substance, click Add Substance, which is this section right here, Add Substance, link, and complete the remaining fields pertaining to the consumer substance use. Again, this needs to be current. This section is for illicit substances, not for currently prescribed medications if they are being taken as prescribed. Previously reported substances may be displayed here, but it is important that it be updated accordingly. So if they no longer use a certain substance, say they were using heroin, and you want to keep that in here, you would just say frequency of use none in the last month, or however long it's been. If the substance was added in error, you'll click this red X to remove it, but important to note there's no warning before the row is permanently deleted, so make sure you are really wanting to delete that before you click the X. And then, yeah, so if you want to add more substances, you can just keep clicking this blue button. So the drug screen results section is another important thing we look at when authorizing. So you want to indicate the UDS results for the previous report period. So anything in the last concurrent review, so say the last UDS result was from November 20th. So anything since then, you would want to add, so starting the 27th would be in this concurrent review. So for each drug screen, click the Add Urine Drug Screen link right here. Put the date of the UDS, this is very important. Sometimes we get a lot of errors here, so double check that the date is correct. And then you can manually enter in the date or click the icon to search and select the date. Then for UDS results, again, some people click on the wrong one, so double check. So either negative or positive, what the substance was. And then if they're medication-assisted treatment consumer, do the results reflect compliance with medication? Yes, no, or not available. And then for the substance, use the drop-down menu to select the substance. I didn't say that part. And then in the comment section, you can enter comments as needed. Again, if you need to remove this, if you put in a wrong substance or something, you can click the red X, and then to add another substance, you can keep clicking the blue plus sign. So things to remember with these UDS results. So UDS results that are positive for substances should have comments in the substance chart that indicate the route, frequency, and amount used over the last 30 days. If the consumer reports that there's a valid prescription for a positive substance, specify within the comments column if this has been verified by MAPS or current prescription, and if there's any coordination of care or collaboration with the providing psychiatrist, specialist, or PCP. If a client is receiving MAT and the UDS result is contraindicated with the MAT being provided, for instance, Xanax while taking methadone or Suboxone, for example, please include the clinician and doctor's recommendations for remaining on MAT, and also include any information about dosing changes. The next section is treatment plan goals. So in this section, you will first enter the goal number, the goal description, and progress towards goals in the provided text boxes. Remember that these goals need to be SMART. That stands for specific, measurable, appropriate, realistic, and timely. In order to provide rationale and medical necessity for the recommended level of care, these must be individualized and specific to the consumer. Please do not submit reviews with the same goals for every client. These should not be cookie cutter and generic. They really need to be based on each client's specific goals and treatment plan. Goals also should not be goals that could be said for anyone with a substance use disorder who is in treatment. For instance, a goal to stop illicit drug use, to stay clean, to be sober, or continue in treatment, or to take methadone. Those are just generic, pretty obvious goals for everybody in treatment. Next is the progress towards goals section. So this is where you would put it right here in this big box. Progress towards goals should be written in the text box. This section should explain which objectives are being addressed or have been addressed or completed during the last report period. Please be sure all goals and associated objectives are taken from the individualized treatment plan, and that they are goals that will be addressed in treatment, not outside of treatment. For instance, housing, getting a job, getting a medical marijuana card, those are all great goals, but they are not clinical, and they're not what's being worked on in the actual therapeutic session. So those should not be part of this. The objectives correlated with each goal should be expanded upon in both progress towards goals, what the client has accomplished, and on the next page in rationale for continued stay, which is reasons why treatment at the current level is justified. Next, we come to the authorizations tab. So you will provide your authorization request and time frame requesting the correct CPT codes and units as outlined in the frequency and duration that matches the treatment plan of the client. Rationale for continued stay should address this information as well. If a client is stepping up or stepping down to a different location than yours, you do not need to request the CPT codes. I know a lot of people get confused on that, so very important. Do not request CPT codes for a step up or a step down. Please include the anticipated discharge date as well as information where the client would like to attend treatment at the next level of care. We will need this information to input the authorization. So we would put in that auth ourselves, not you. So to add an authorization, you will fill in the fields on the authorization request. So the provider, this is important, this field will be read-only and can only be edited on page 1 in the basic info section. The authorization effective expiration dates, you will select an appropriate date range, and this could only go up to 90 days, and this is based on the dates on the current treatment plan. The provider notes, you can put in this field, this is optional, but you can put any documentation of clinical rationale or other explanation for the services being requested. For instance, if they were an outpatient and for the first month they did not need to see a doctor there, psychiatrist, you could put in this review if you're just requesting the 992XX doctor visit code. You could put in the provider notes, you know, the client is now needing to be seen for their mental health, or possibly to be put on Suboxone or something like that. And so you're now requesting the doctor visits. Okay, next you're going to do the request services. So at the very bottom of the page, click the request service link to add the CPT codes you are requesting. So you will enter a CPT reference, description, or code right here, the arrows pointing, and click search right here. A list of services will appear based on the program selected. Click select next to the service you are requesting, so any of these. So in this section, the effective dates from and to, these fields pre-fill based on your selection in the previous step, but you can adjust these as needed. So if certain services don't need to go the entire 90 days or 30 days and you only want a few weeks for one service and longer for others, you can adjust the dates there. And again, these dates should reflect what is written in the client's current treatment plan. So the units per period, you will enter the number of service units needed using a range, for example, 4 to 8, or you can just put in the 2. You don't have to do a range. You can just put 2, which would be the total units that you're needing for the authorization. The frequency is right here. That's a drop down. You will select how often the service should be provided based on what is in the treatment plan. So once a week, once a month, once a quarter, etc. And then total units requested, it will automatically calculate this for you, so you don't have to do the math yourself. So you just click this calculate button, or if you want to, you can manually calculate. And if you want to add more services, you would click this request service button, and again, to remove, click the X. So this is very important to keep in mind. These are basic guidelines and may differ from what you are given in Cricut, but these are just a guideline to kind of get a basis for what we authorize and why. So for initial authorizations at the beginning of services with a provider, typically these are generated based on the following. So withdrawal management right here, also known as detox, 1 unit authorized equals 1 day. Typically, we will give 5 days or 5 units up front within a 30-day authorization period. Short-term residential, 1 unit also equals 1 day. We will typically be given 14 units per 30 days. But of course, if the client still needs that level of care after the 14 days, you will request another, or you will complete another concurrent review, requesting additional time, and we will typically give these in 7-day increments until discharge. For long-term residential, 1 unit equals 1 day. Typically, we give 30 minutes up front per 30-day authorization period. If we are to add additional time, we typically give these in 30-day increments as well, but that's not a guarantee. It depends on the individual and the program that they're in. IOP, 1 unit equals 1 day. Typically, we give 15 units or 15 days within a 30-day period. If there are going to be reauthorizations, we give those typically in 5-day increments. For outpatient, the CPT code of H0004, which is individual therapy. This is where people get caught up a little bit because it's billed differently. So it's actually broken down into 15-minute increments. So 1 unit would be 15 minutes. So 4 units equals the hour that most people are asking for. So on some requests, I get clinicians asking for 1 unit per week for the client when they're really asking for 1 hour per week. So I would change that to a 4. So it's good to know up front in training to just start getting this in your head that 4 units equals 1 hour for individual. That way, if you're only going to do 30 minutes a week or 45 minutes a week, you can request those also accordingly. And typically up front, we would give 48 units for outpatient. For groups, it goes back to the regular 1 unit equals 1 group. So that's not broken down into time increments. So typically for groups, we would give 12 units or 12 groups within a 90-day period. Reauthorizations, We typically would give another, depending on the treatment plan, if they're attending 2 or 3 groups. It just that really varies based on what the client's actually doing. And please be sure that you pay attention to the number of units authorized, not only the time period the units are authorized for. Additional time is always possible to request through the concurrent review process. These are not prescribed amounts of time or time periods for all clients. Each individual treatment plan determines the scope, frequency, and duration of treatment. So again, as long as there's justification and rationale for why you're needing more time or a different amount of time, we can look at that on a case-by-case basis. Also to note, the authorization period may be shorter than what is typically authorized, so please, please, please be sure to check the dates when something's approved and the number of units of an approved authorization. For example, if a client relapses at the outpatient level, when we authorize services, we may authorize a shorter time period, so not 90 days, we may only give 30 days with an increased number of units. So instead of being seen for individual once a week, we may bump it to twice to monitor and support the client through an additional month of outpatient, just to see if they're at the appropriate level of care and to assess if they need to go to residential or something like that. So once the data entry for the auth request is complete, you have the following options. You can press Save and Pend. This is if you have not completed the data entry and want to save your work. Process Request. When you have finalized the data entry and are ready to formally submit the request, you click Process Request. Cancel functions like the back button. It does not save your entries you have just made and exits you from the screen. So you do not want to do that unless you totally want to start over. Please note, this step only processes the authorization request. You still need to process and submit the review itself by completing the following steps. So next is the Diagnosis tab. So diagnoses may pre-fill here from other Cricut documents. Please be sure they're all current. And to add a diagnosis, click the Add Diagnosis link right here. So you'd enter a diagnosis description into the field right here and click Search. Once you have found the diagnosis code you are seeking, click the Select right here, and it will populate into the screen. To update the status of a diagnosis, you go to the Status column, click the down arrow, and select a status. Be sure the status date is correct. And to add an additional diagnosis record, click the plus button right here and follow the previous steps when searching for a diagnosis. To change the sequence, diagnosis code, or to delete, click the 3 horizontal lines or hamburger icon, as some people call it, right here. Note, if you see a red message, like the one down here, in the diagnosis screen, this means Cricut was not able to automatically make a one-to-one match of the ICD-9 to ICD-10 code or the switch to the DSM-5 code, and you will have to choose the appropriate code in order to proceed. To resolve the issue, move your cursor to the right of the diagnosis line and click on the hamburger icon to make changes. Click Change Diagnosis Code and determine the appropriate ICD-10 code match and click the Select link to the right. So you would next click the Save button to save the information but not submit it for approval yet, or click the Save and Submit button to save the information as well as submit for review for approval. So if you do not press this button, it will not come to our end for review. So this is a very important final step to submit it to the PIHP. Then what? So please be sure to check the Concurrent Reviews disposition page for any notes we send back on approved reviews. A lot of people ignore this and don't go back and look at it, but this has very pertinent information. It can have questions for the next review that need to be answered, just updates, reasons for why we may have shortened the length of time or added additional time, things like that. So it saves a lot of time and back and forth if you would just read that disposition, no matter if it's approved or sent back as pending. So like I said, reviews may be pended back to providers for more information. So be sure to check your SUD concurrent reviews pending queue. So this is seen, whoops, right here. So a current review is pending if it has been started but not yet submitted, or has been submitted but was returned because additional information was necessary. So again, this is where you'd see the disposition on the review for information and instructions. For instance, if you forgot to fill out the ASAM section and it was blank, or the UDS section was missing a lot of dates and there was questions about that, or other areas of the review were left blank, that's where you would find that information about why it was sent back. So in this case, the review should be looked at and responded to as follows. So you click on SUD in the main menu, and then click SUD Concurrent Reviews Pending, which is right here. To update a pending review, click Change, and the concurrent review will open in an editable format. You would make any appropriate changes and then check the disposition, which is this tab right here, for specific instructions or questions. And then you would navigate the concurrent review by clicking Save and Continue button to save and continue to the next page, or click a link on the index right here to jump to a specific page. So after this step, you have to resubmit. A lot of people forget this part when they are working on pending reviews. So click again on the Save and Submit button from the diagnosis page. And if you don't, we won't see that any changes have been made until this step is completed. So again, make sure you do this. So if you have any questions or problems, please feel free to reach out to your representative at CMHPSM. And also, if you need more help with this, more training, there is a concurrent review help document in the Cricut help menu, and that button is located next to log out in Cricut. All right, that is the end of our training. I really hope this was helpful for you. And again, if you have any questions, feel free to reach out. Thank you very much.